Good morning. It is Thursday, January 7th, 2021. Welcome to The Doctor is In, Ask Dr. Arwady. I am Sybil Madison, your Deputy Mayor for Education and Human Services. I'm here with Dr. Allison Arwady.
I'm happy to be back with you. It's been a little bit.
I know. Happy New Year.
Happy New Year.
I know that you know this, but Dr. Arwady is your commissioner for the Chicago Department of Public Health. This is where you can get the latest on COVID-19 in Chicago, including the latest on vaccine in Chicago. And we're happy that you're with us, and we're happy to answer your questions. You can put them in the chat box below, or you can send them to us via Facebook or Twitter using the hashtag AskDrArwady. We're going to check our distance. It looks good. Also a good reminder that even as people are getting vaccinated, we still need to do the things that we know will keep us safe, which means watching our distance, wearing face coverings, and washing our hands. Those behaviors don't go away.
Even post-vaccination.
Even as vaccine comes into play. So Dr. Arwady, why don't we start with you with the latest data?
All right, sounds good. As always, chicago.gov/coronavirus. Right up at the top, you go to latest data. And if we pull up the website here, you can see our positivity is up a little bit from last week. It's at 10.7%. But a lot of that is being driven by the drop in testing related to the holidays. We average out over 7 days, as you know, and we're currently averaging about 10,834 tests a day, which is really down quite a bit. And so given that positivity is the number of positive tests divided by all of the tests that are done, if that denominator, all of the tests that are done, goes down a lot, your positivity will also go up. So our daily cases overall are also up just a little bit. Again, some of this is related to some of the changes in testing. It's just a lot of instability after the holidays. But we're at 1,012 per day, and keeping a close eye on where things are. But broadly, we certainly are in a much better place than we were, 4 to 6 weeks ago.
As you can see by the graph.
As you can see by the graphs, and as over this next probably week and a half, I'm hoping we'll kind of settle out post holidays. Let's also just take a quick look at a little bit of the vaccine data, if you don't mind. I showed people on Tuesday, right here under latest data. You go to vaccination data, and there's a number of ways you can look at it, but right up at the top here is where you can look and just see the cumulative data as it loads. There we go. So you can see every day we update this, and as of January 6th, we were up to about 42,600 doses here in Chicago. And you can also, and we are working actually, we're expecting really quite soon to have more of an interactive dashboard available. There's been a lot of work behind the scenes to clean this data. I'll tell you right now, there are hospitals that are doing vaccinations, and they're reporting them into the registry. We're not losing anybody's vaccine data, but there's a lot of steps between when someone gets vaccinated, that gets entered into the computer. On the hospital side, it needs to get sent to the state registry, which is iCare. It has to get pulled out and sent back properly. So a number of our hospitals that we know have been doing a lot of vaccine still are not showing up to have vaccines in there. So one of the reasons people have been asking, why do your numbers look a little bit low? One is that there are lots of vaccine that's actually being given that's not yet showing up in our numbers, and every day we're sort of getting those problems sorted one by one. But also about 59,000 of our doses we actually had to pull out and hold for the long-term care facility program. So that is a federal requirement. I think it's a really good requirement. It makes sure that there is enough vaccine available for all of our highest risk long-term care facilities. Those get administered over the next few months, but those have been pulled out, and so we don't pull them out in the numbers here. And then the last thing is that this is only reflective of Chicago residents. 42% of the vaccine that we've been receiving here in Chicago and administering here in Chicago at Chicago locations is actually going to non-Chicago residents, because we have a lot of suburban Cook or DuPage or Lake residents who work in Chicago. Not a problem. They work in Chicago. We want them vaccinated. But those numbers don't show up in our Chicago data. So those are some of the reasons.
And specifically work in our Chicago hospitals.
Correct.
in healthcare.
Exactly. So exactly, we do not, we want people who are working in Chicago healthcare settings to be getting vaccinated right now. Let's also pull up some of this map data. So if you saw, I went back to the vaccine tab and we're looking by zip code. Over here, you have to set the range that you want. So if I want sort of the cumulative range since vaccine has started, I got to change that a little bit. And you can see that COVID-19 vaccinations by zip code, I'm going to close this legend for a second so we can see it, are varying a lot. We're seeing a lot more vaccine being administered in some of our zip codes right around the loop and on the north side here. And you can see that the percentage of the area is also fairly different. So like if we look here in this zip code, 60636, there's only been about 70 vaccines given, 0.2% of the population, whereas up here we've had 2,000 vaccines given or 1,800 vaccines given. And again, this is partly reflective of the staff that work in Chicago hospitals, where most of our vaccination has been given. And partly reflective of the fact that vaccine has now been offered to all of the frontline COVID-facing employees in Chicago hospitals. We've asked Chicago hospitals to expand out and be offering vaccine to all of their staff. Anybody who is connected, inpatient, outpatient, and now working very hard on our outpatient healthcare providers. We know that more people who are Black and Latinx, there are more represented in some of the support healthcare occupations, and really working very hard to make sure that those folks are being offered vaccine just like the frontline healthcare workers are. And we're working to get vaccine to all of these long-term care facilities and other congregate settings. So that's where we are right now. I encourage you to keep looking at the data, but I think maybe let's get right into questions because I know people have a lot of them.
Yes, there are a lot of questions here. Let's take this first one from Kathy Lavelle. From Facebook. How do you feel after the vaccine?
I feel really happy after the vaccine, first and foremost.
When did you get it?
When did I get it? I got it
last week.
Last week. It was. I got it the day that we opened our first city point of dispensing. So that was last Tuesday. Now I think about it. And we did that just as a reminder. The points of dispensing. This is the city standing up large mass vaccination sites. We started at Malcolm X, which of course is our community college that trains our healthcare workers, many here in Chicago, and that pod is only open by appointment for Chicago outpatient healthcare workers. And the way it works is those facilities, whether they're dentists or home healthcare workers, podiatrists, outpatient clinics, et cetera, those facilities have filled out a form on our website, and then we send codes back to the facilities as there are space available. So we've had good uptake there, but I do see patients, as you know, and so I was really excited to get the first vaccine in our pod. I feel good. Right away after the vaccine, I had no symptoms actually whatsoever. I didn't even feel it, honestly, when it went in. And for about a day, maybe a day and a half afterwards, I could just feel that my arm was maybe a little bit sore. I didn't even, I've been filling out every day the symptom screener that I get on my phone, and I didn't even call it pain the first day. It wasn't pain, it was just a little bit sore. I actually didn't have any other of the side effects. We do see people having sometimes headache or feeling tired, or having some muscle aches, occasionally a low-grade fever for a day or two. That is not COVID. That is just the immune system. It's your body, right? It's your body teaching your immune system how to fight off COVID. So I didn't happen to have any of those. I had just a tiny bit of a headache, and I was like, am I getting a headache from the vaccine? And then I ate lunch, and I didn't have a headache anymore. So I feel really good. And mostly I feel just happy that we've gotten to the point to be able to start vaccinating in Chicago. I'm so excited, the fact that we can be offering it to healthcare workers. We've been able to offer it to all hospital-based frontline health workers at this point. We're right now pushing really hard in our long-term care facilities. I can't tell you how much I want that vaccine, want people to have access to this, especially in those settings where we've seen such a lot of cases and hospitalizations and even deaths. So it feels really good.
It was an emotional experience for a lot of those frontline workers, right?
Yeah, absolutely. I mean, a lot of our healthcare workers have been doing this day in and day out, and, seeing what it looks like to be really seriously ill with COVID, and, families can't be there, and it's been really hard on our frontline healthcare workers. And I just love that we're at a point, first for them, but then also in these congregate settings that have been really high risk.
Yeah.
And I'm really excited, once we can get through this group, to be able to start opening it up to older Chicagoans and to a lot of these other frontline essential workers. So it just feels good to be making progress. And I love science, right? And so being able to see this and be able less than a year after this virus was discovered,
is remarkable.
Have a vaccine that is safe and 95% protective against COVID is pretty amazing. So.
Yeah. So you get your second shot.
I'll get my second shot. So because I got the Pfizer vaccine, my second shot comes 3 weeks later. So I'll get my second shot in 2 weeks. People who get the Moderna vaccine, the second shot is 4 weeks later. And for everybody, you go back to the same place that you got your first vaccine. You get text messages, there's sign up. We're really working hard to make sure people get that second dose. Because even after that first dose for the Pfizer vaccine, I'm only considered about 52% protected based on the data. It's after that second dose, and really about a week or so after that second dose, that I get that 95% level of protection. Even then, though, I keep wearing my mask. I keep doing all of the things that I've been doing. It's not 100% protective. We still have a lot of COVID around, and we're still learning a little bit about how this vaccine is protective.
All right. Thank you, Kathy, for checking in on the doctor. Donna Cameron from Facebook, what is your thought on pregnant women getting the vaccine? And then the second part of this is the vaccine gluten-free for people with gluten allergies?
Yes, the vaccine is gluten-free. We actually recorded a frequently asked question about, it's gluten-free, there's no egg allergies, there's no other food allergies that are of concern, any kind of food allergy that is of concern at all with this vaccine. There's not a concern with bee stings, there's not a concern with latex, there's not a concern with environmental allergies or pet allergies or allergies to oral medications. The only real concern where it's been recommended that people not take the vaccine or at least have a conversation with their doctor is if you have a history of severe allergic reaction to another, to any component of the vaccine. So if you've had a prior allergic reaction to a vaccine or to an injectable medication, talk to your doctor. Otherwise, the recommendation is actually to move ahead. So related to pregnant women, so the CDC, and I encourage you actually, we do have information on the website, chicago.gov/coronavirus, right up at the top, vaccine, but also the CDC has a lot of information. And I always encourage women who are pregnant, to talk to their doctor. I think it's really important to be able to have that conversation, have your questions answered. There is absolutely no concern that this virus interfaces with DNA, which is sometimes I hear people ask about in the context of pregnancy, or that it interferes with the placenta in any way. And so the CDC, has said that it is appropriate for people to go ahead with vaccine in pregnancy, given that the risk of COVID in pregnancy and those bad outcomes is significant. But if you look at the specific language, they also do encourage people to, have that conversation with the doctor. I want people to feel confident in getting this vaccine, and everybody's making their own choices. She didn't ask about this, but a question we get a lot is, has there been a link to fertility or anything like that?
I was going to ask about that for women who are childbearing age.
Yeah, and no, again, and this is one of the things. There's just a lot of chatter, and obviously people have questions. We want people to have questions. But there was a piece of information going around that was suggesting that somehow this was interfacing with the placenta or making it, less likely that you would be able to carry a pregnancy to term. There's no evidence that I have seen that is at all true. And certainly I have a lot of friends who are, of childbearing age or thinking of becoming pregnant. And I have encouraged all of them personally to absolutely go ahead and get that vaccine so that you're protected, before you're sort of moving into pregnancy. And that pregnancy state is also about the fact that your immune system really can change a lot in pregnancy. The CDC is tracking people who are pregnant. So when you do that, if you get vaccinated, they actually ask you when you fill out that survey the first time, are you pregnant? Yes, no, or I don't know. And then there is some work to actually follow on with folks who are pregnant and getting vaccinated. Again, sort of as an extra follow-up. But I would encourage you to talk to your doctor if you're pregnant, but at least, when I look at it, I worry more about the risk of the severe outcomes, that we've seen with COVID. But, do talk to your doctor if you have more questions.
Okay. Leonore Chen from Facebook, I think your question has been answered, but I will just, by this answer we just got, but for people who have severe allergies, is the risk for adverse reactions higher?
So, I'm not entirely sure. Let me answer this question two different ways.
Yes.
If the question is, if I have severe allergies, am I more likely to have like the muscle aches and all of that? No, like there's no link between that. Where this concern about the severe allergies has come up, again, it's really been focused on just the components of this vaccine. And when we say severe, that means like I carry an EpiPen. But the CDC has been clear, and we've actually been meeting with allergists here in the Chicago area also, who are looking really closely at all of this allergy data, making sure we're prepared, et cetera. We do ask everybody at the time that they're getting vaccine, no matter where you're getting it, do they have a history of allergies? Do they have a history of severe allergies? If so, what to? Mm-hmm. And everybody we monitor after getting the vaccine. So like in our pods, for example, half of the whole gymnasium is taken up by the space where people are sitting socially distanced with their masks, and we're monitoring them for at least 15 minutes regardless, and then we monitor them for 30 minutes if they've got a history of allergies. We're absolutely prepared in case somebody has an allergic reaction, but countrywide there have been more than 5 million of these vaccines administered, and there's been just a handful of the more severe allergic reactions. It can happen with any vaccine, but it is not a common reaction. It is rare.
That's good to know, because when you hear about somebody having an allergic reaction, it can lead you to think that, oh, this is happening all over the place.
Yeah, not at all, not at all. And also there's a lot, we will, and when they ask about side effects, some people may have a little bit of sort of some itching or some redness, that could be sort of a localized, we call it more of a hypersensitivity than an allergy, but you can see some of that. What we really would be concerned about is if somebody had a more significant allergic reaction, but we are set up, in the unusual event that were to happen, that's been looked at really carefully, and it is a requirement if you're administering vaccine, anywhere in the country to be prepared for that. But I don't want people to, be so worried, about the allergy to the point that they're feeling like they don't want to get vaccine. But certainly, again, if you're somebody with a history of these severe allergies, talk to your doctor, talk to your allergist. I want you to get your specific questions answered.
Right. By the person who's been taking care of you.
By the person who's been taking care of you and knows you. But generally speaking, the allergists, except for people who have actual allergy to a component of that vaccine, are recommending that people move ahead with vaccination.
Got it. Okay, here's a question from Erica Allison, and it's somewhat related to a question from Marcia Gundrum, both from Facebook. From Erica. Cook County recently put out somewhere to sign up to get information about when you were eligible for the vaccine. This has caused a lot of confusion for my friends in Chicago because we are part of Cook County.
Yeah.
Can you explain what people in Chicago should do to know when they can get the vaccine?
Yeah, absolutely. So it definitely can be confusing for people, for sure. So thanks for that question. So the city of Chicago receives vaccine based on the city of Chicago's population, and we administer it and distribute it to facilities within the city of Chicago. The Cook County Department of Public Health should more formally be called the Suburban Cook County Department of Public Health. They have the responsibility, for Cook County outside of the city of Chicago. And I know this can be confusing for people, and we work pretty hard to try to label everything. This is for the city of Chicago, this is for Suburban Cook, et cetera. But within the city of Chicago, so some people certainly, did sign up for our Chai COVID coach early on, and through that way, certainly we can email people when it's available, but it is not a requirement at this point for general population. It does not put you in a line. There's nothing that you need to do as an individual at this point if you live in the city of Chicago to get vaccines sooner than anybody else. We in Chicago here have been working really hard. We're in 1A, and so we've worked hard to push out, the information that healthcare workers need. And again, one person from any healthcare worker practice fills out the survey, and then we make vaccine available to that whole practice at once. We've had more than 5,000 practices fill out that survey, representing about 100 115,000 workers. So that news has gotten out very well. And when we get to the point where we are starting to move on to more general Chicagoans, maybe we'll just talk at a high level what that's going to look like. So older Chicagoans will be next.
And that was Marcia's question.
Okay,
how
good.
will we be notified when vaccines are available for the next phase, 65 and older?
Yeah, perfect. All right, perfect. So a couple things. So one is that there is not going to be enough vaccine for everybody, particularly in the older age group, like just to be really clear about that. We're getting right now 32,000 first doses of vaccine every week. And, we have hundreds of thousands of healthcare workers and the long-term care. That's why we're still getting through that group. But even as we think about what comes in that next group, we've got our older Chicagoans. We've got more than 150,000 Chicagoans who are over 75. And then we've got another 207 plus who are between 65 and 75. So we've got about 360,000 Chicagoans who are over the age of 65. So we actually may start with people who are over 75, sort of at the beginning where we think about risk. And then once there's some more vaccine available, move to 65. But most older Chicagoans are going to get vaccine through their healthcare provider. We are working really hard right now. Finally, this coming week is going to be the first week we have significant amount of Moderna vaccine, which is the vaccine that doesn't require that ultra cold storage, can be held in the freezer. The best vaccine really for outpatient providers. Most of the Moderna vaccine we've received to date, like almost all of it, has had to go toward those long-term care facilities. We want them to have the vaccine that can be in the freezer. We want it to be available, all of these things. But what we're doing is sending that vaccine. The reason why we had providers sign up is that for doctors' offices, for federally qualified health centers, places that you would normally, pharmacies, places you would normally get your flu vaccine, your tetanus booster, your health care, that's where we want people to get their COVID vaccine. And so right now we're working to get that Moderna vaccine to the outpatient practices. They're starting with vaccinating their own healthcare workers, but then they will have all the training done, all the paperwork, and we'll be able to send vaccine to the freezer to get it through your doctor. And then we will be also at the same time that we move to older Chicagoans, remember, we'll be focused on these frontline essential workers. So this is the correctional officers, and some of that is already starting with the healthcare worker correctional officers, the first responders, the educators, the people who work in grocery stores. Manufacturing, some of these settings that we've seen outbreaks and that a lot of people in our hardest hit areas in Chicago from COVID work. We'll be working, the health department will largely be working to make vaccine available through employers there, and we will continue to use our large points of dispensing. But most people, again, will be through their employer, if they work in the essential worker, through their healthcare provider, and then we'll be supplementing that with strike teams and pods as we do now. So it will not be a surprise when it is sort of time for this to become available. It's not going to be for a few weeks, and there's just not going to be enough for everybody, and I know that's sort of hard to hear. Our goal is never to sit on vaccine, right? And so we've pushed more than 95% of it out here. And as our healthcare work, really our hospitals just this week were able to get through those top line providers. They're starting with their second doses this week. And we said move to all your other types of healthcare workers, right? Inpatient, outpatient, support staff. If you work in the healthcare setting, and then please support our physical therapists and dentists and home healthcare workers and podiatrists and optometrists and all the other people who make up that outpatient healthcare milieu. We're working on really getting them connected to that vaccine over these next few weeks and building up that infrastructure so that your provider will actually be able to give you vaccine.
Yeah. Okay. So with that, I think you answered Debbie V's question, which came in from Twitter. Is Chicago following IDPH's decision to lower phase 1B to 65 plus?
Yeah, so we will consider, so in the same way that we're tiering, within 1A, we started, it's congregate settings. We started with those long-term care. We started with the highest risk workers, and then we're going to the next level, the behavioral health and the developmentally disabled congregate settings, and then we're moving to the homeless shelters and the correctional facilities and the convents. And on the healthcare worker side, we started with the hospital-based workers, and then we went to the outpatient, and we're doing some of these outreach, COVID workers, et cetera. it'll be the same thing, I think, as we move ahead. So we may start again with 75 plus, just with the amount of vaccine that's available, and then open it up to 65 as some more comes in. There's a lot of conversations about what those logistics will look like, and we'll have more details to share really over the next week or two as we figure this out. But and then similarly on the, we really want to make sure there's enough vaccine to vaccinate on the essential worker side. There are just so many people who are over 65 in Chicago with the amount of vaccine we're getting. It would take, 32,000 a week, 360,000 people over 65. It would be 10 weeks if we didn't do, there's 150,000 people just working in education. So we need to sort of recognize that this is meeting both sides. And, from an equity perspective also, there are not as many Latinx people in particular over the age of 65 in Chicago. It's just a much younger population. Latinx communities, especially hard hit by COVID here in Chicago, lots of essential workers, right? Working in the grocery stores, working in these manufacturing settings for those individuals, but also from a controlling COVID in Chicago perspective. I can't have a map where one part of the city is very, very highly vaccinated and another part is very under-vaccinated. That is not, that just lets COVID continue to really spread and grow in that neighborhood, and it doesn't help us actually as a city. So there's a lot sort of to think about from an equity perspective. Our goal always is to push vaccine out as quickly as we can get it in a way that makes it available to the people who are at highest risk and lower barriers to vaccine in communities that may have more barriers.
Got it. Thank you.
Yep.
At Brownbird87 from Twitter, I was wondering, what is the definition of a long-term care facility? My mother, 85 years old, is in an independent living facility, and I was wondering where she would fall in line to get vaccinated.
Yeah, great question. Very great question. Okay, so there's been a lot of conversation, and this has actually been very well defined federally. So a long-term care facility, in the strictest definition, includes first the skilled nursing facilities, and second the assisted living facilities. You'll note I did not say independent living in there, and this is because independent living means that people actually can independently go and get a vaccine, like from their healthcare provider. And so they are not considered a congregate setting in the same way. I will tell you that from an operational standpoint, the federal government sort of through the pharmacies, in some cases, if there is a location that has both a skilled nursing facility and perhaps an independent living,
be a hybrid.
It might be a hybrid kind of model. There may be settings where vaccine may come and they may be able to get it in that setting. I don't have a problem with that, but we are not separately sending vaccines, certainly in 1A, to these independent living facilities. Now, somebody who is 85 very clearly is going to be right at the top of the list there, where we're thinking about, as we open up to older Chicagoans, and what we're thinking about operationally, just to give you a little more insight into this, depending, I don't know where your mother lives, but if she is living in an independent living facility that perhaps is in an area where we're seeing less uptake of vaccine, we may be doing some more strike teams to those kinds of facilities. We'll be looking at this, but the goal is certainly to make sure people like your mother are able to get vaccine. I want an 85-year-old to get vaccine way before I want a 65-year-old to get vaccine, like in terms of some of what that looks like. And mostly, if she's in an independent living facility, I want her to get it through her healthcare provider. If that's not possible, we'll be looking at some other options for her.
Yeah, and it may be worth noting, I don't know, that in these long-term care facilities, in these skilled nursing and assistant living facilities, that's where we saw 30% of our deaths,
yeah,
right?
Exactly.
So
right. Yeah, the skilled nursing facilities in particular, and these are settings where people literally, you need hands-on care. Like, they're high risk, very vulnerable population, a lot of COVID outbreaks, not just here, but across the country. And although we were able to get them under quite good control, certainly compared to at the beginning, it's been a ton of work. And actually, first, I care about protecting the residents and staff who live in that healthcare facility, but it also, having high vaccination rates in those facilities actually takes a lot of pressure off the health department, because we put a lot of resources into helping with outbreaks and keeping that under control and doing infection control. And it's a lot of cases and a lot of exposure. It sort of drives, it disproportionately drives our cases. And then if there are people working in that facility, moving in and out, bringing them back to the community, these are exactly the settings that I most want vaccinated. They will have the biggest impact on us controlling COVID in Chicago. So that's sort of what we're thinking about. There's the individual piece, but also from a public health perspective, where can I push vaccine that will do the most to protect vulnerable individuals and help stop transmission of COVID?
Yeah. Okay. Trudy Leon from Facebook. Is the vaccine only for a recipient to prevent developing symptoms? Meaning the recipient can still remain contagious.
Okay, so we're getting variations on this question a lot
yes.
too. So there are still ongoing studies, and I know people are always like, oh, you tell me there's still ongoing studies, but we are still doing a lot of studies related to this vaccine. And what we were able to show in the trials, what the manufacturers had to show and showed very well, was that the vaccine helped prevent the person from getting COVID, and especially symptomatic COVID or severe COVID. Again, it was 95% protective in terms of doing that. But there is still some question about, could there be people who have asymptomatic COVID? And if they had asymptomatic COVID, do they have enough COVID that you can actually spread? Like some of this has to do with how high, it's very layered. How high is your viral level? Are you actually shedding it? Like some of this. And so there are studies happening for people who are continuing in these trials where they're doing nasal swabs on people when they're coming, and not just do you have symptoms and testing them, but looking to see, can they actually culture any COVID? And not just can you detect COVID, but can it grow? Can it spread? We don't fully have the results to those studies yet. The preliminary data actually looks good on this, that it does look like it should be protective against also spreading COVID. Perhaps not 100% protective though, right? In the same way the vaccine is not 100% protective for me, it is probably also not 100% protective against this. I don't want to speculate because I don't have data yet to share, like not full data. We've just been able to see some of the preliminary answers, but it is as more data comes out for these trials, it's one of the things we're the most interested in. So one of the reasons that we recommend that people continue to wear that mask and do the social distancing even after vaccine is that it's not 100% protection, even though it's really good. We have a lot of COVID around, but also as we're still learning about some of this risk, we just want to do everything we can, this layered mitigation strategy, to prevent the spread of COVID. And once we do have more of the population vaccinated, the risk keeps going down and keeps going down and keeps going down. We are going to get to a point here in Chicago in 2021. I feel confident about this. We won't need to be wearing the mask. We won't need to be doing all that.
In 2021?
In 2021, I think so. I think so. I'm feeling good about that. Assuming the vaccine keeps performing like it has been and people have good uptake of the vaccine, I think we will get to that point. But that is not now.
But not yet.
That is not in the next few months.
Okay, so you just answered Alex de Miranda's question, which came in from Facebook. Should we continue to wear masks after taking both vaccine shots? And the answer is yes, Alex.
For now, yes.
Becky Pritikin has an interesting question here. What happens if someone is exposed to COVID after the first shot? Can they get the second shot?
Oh, that is a good question. Okay, so first of all, because the vaccine is not 100% protective, it is absolutely possible for someone to get infected with COVID after getting the first shot. Remember, I just told you I got the Pfizer vaccine. Based on the trial data, I'm about 52% protected, which is a long way from 100% protected. That vaccine did not give that person COVID. I know that wasn't her question, but I got to just throw that one in there. Completely impossible for the vaccine to give you COVID. There is no COVID vaccine, no COVID virus in it, no part of the COVID virus, et cetera. But the original question, was...
So if I'm exposed after the first, can I get the second?
Can I get the second? Yeah. So we would not want you to get the second COVID vaccine while you were infectious with COVID. And that is mostly from an infection control standpoint. I don't want you coming into a hospital. You have to stay home, right? Remember, you have to stay isolated. The last thing I want you doing is going out to try to get your vaccine. We would want you to wait until you had recovered from that COVID, so at least the 10 days, and with all of your symptoms gone, and then you would be able to get that second dose of COVID. And really, what you would have had there, you would have had your first dose, you would have had some COVID infection, probably, which is sort of a little bit of a natural booster for immunity, and then you'd get your second dose and would be considered to have that same level of protection as if you had not had COVID in between.
Okay. I think that we are just about at
my
the
goodness,
time
are
for
we?
good. Yes,
That was fast.
I know. I think we went through a lot of questions. I was trying to find a quick one that we could end on. I mean, this one is. I know that this one has a quick answer. So this is from @plantman2310. Does every vaccine have aborted baby tissue in them? Does #niacin cure COVID?
Okay, so we know the answer to that one.
Yes.
So there is.
But I think it's important to take questions that.
Absolutely, because maybe people still have questions. I know there's a lot of misinformation out there. So there is no aborted baby tissue. There is no fetal tissue. There is no fetal cell, cultural cell line, anything related or in this COVID-19 vaccine. And there is no cure for COVID, importantly. The vaccine helps prevent COVID. We do have some treatments available that can help limit the severe impact of COVID, but we absolutely do not have a cure for COVID, and niacin, which is a vitamin, is definitely not a cure for COVID.
Okay. And I've heard things about vitamin D, just different vitamin supplements.
That's right. And we've talked about this a little bit. Certainly, the healthier you are, if you were to get COVID, the better it is for you, right? And so in the same way that it's better if you're not smoking, it's better if you're getting good sleep and taking care of your immune system, all of these things. Eating well, if you are vitamin deficient and your doctor is recommending you take a vitamin, or if you take a regular multivitamin, take that regular multivitamin. But I have not seen good evidence, and we do have a lot of people in Chicago who are vitamin D deficient. So, taking that vitamin D.
I'm one of them.
Yeah, I am too, actually. So at the regular, you can take a vitamin D supplement, at the vitamin D level that it is prescribed, and if it helps bring your vitamin D level up to the place it should be, that could be helpful against COVID for sure. But vitamin D is not a cure for COVID, and I just want to be careful because we have seen some reports of people, wanting to take whole bottles of vitamin D, and you can get actually vitamin D toxicity, for example. So you can take a vitamin at the dose that vitamins are prescribed for. Talk to your doctor if you have questions, and certainly that having the right vitamins and good nutrition is part of being healthier. And if you were to get COVID, it would only help in terms of you having a good immune response. But there have been some trials looking at vitamin D and others, and none have been shown to be a cure for COVID.
Got it. All right.
All right.
Now, some good news.
Some good news.
The vaccine is good news.
The vaccine is all good news.
Now we can say some more good news.
Some more good news. Okay, so one is just there's an event this evening. Dr. Helene Gale, who has been on Facebook with us before. She's the president, and has she been? Actually, maybe she hasn't been on Facebook. We've been talking about having her on Facebook, but she hasn't been on yet. But we're gonna bring her on. Yeah, she's willing. It's just scheduling it.
Okay.
So anyway, she's the president and CEO of the Chicago Community Trust. She also worked many years at the CDC, knows a ton about vaccines. She's really helping to lead a lot of the effort nationally to make sure that we're sharing accurate and critical information about the COVID-19 vaccine, particularly where there are questions from Black Chicagoans related to, how has this research been done differently than how the Tuskegee experiment was done back in the 1930s and then moving on through the 60s, like some of these more specific questions that are coming up. So there is a event called
a town hall
called What Black America Needs to Know About COVID-19 Vaccines. It's going to be at 6 p.m. and it's got all the big names that are working on COVID response across the country. Like Dr. Fauci's on it, Dr. Messonnier, who's one of the big CDC leads on it, the incoming Surgeon General is on it, as well as a lot of sort of prominent Black physicians, but also community leaders, really to have a conversation about it. So I'm planning to watch. I think it's going to be really interesting. 6 p.m. It is being streamed either on facebook.com/blackdoctor.org. That's the sponsoring organization. But we're also, the mayor's Facebook page and our Facebook page are also streaming it. So that's good news. And a couple more upcoming things that you can look, if everybody wants more about vaccines. So check out the website first and foremost. We are putting a lot on there. There's a behind the science behind the vaccine, science behind the vaccine clip that you can find under downloads if you want to know how the mRNA vaccine works. Lots of good stuff. But also today at 12:30 p.m., we are doing a town hall specifically talking about long-term care facilities for residents, for loved ones, for staff, for anybody who is interested in sort of vaccine rollout and answering questions about long-term care facilities. And that will be streaming, on the CDPH page. So you can come back in just a little bit. I'll be doing that if you want to ask some more questions or just hear what some of that conversation has been like. And actually tomorrow at 10 a.m. we're doing a press conference also at a long-term care facility. Yeah. Just again to really highlight how important it is to be getting these facilities vaccinated. We've made vaccine available for every resident and every staff member of all types in every one of Chicago's long-term care facilities. Yeah. And there are strike teams rolling it out. And we really want to encourage people who have questions to get those answered. Because
particularly people whose loved ones are in those facilities, right. Especially in cases where they're the ones who have to help give consent, right?
That's right, exactly. And that's right, there's a lot of the memory care facilities and others, sometimes there's language issues. So we really want to make sure that people are getting their questions answered. And again, from a Chicago perspective, there is no setting that I care more about getting vaccinated than long-term care facilities. And so I really want to spend all the time that it takes to get people's questions answered and help them feel, hopefully confident in really getting that vaccine. We've had some, older Chicagoans. I mean, there are people who live in these facilities in their 90s, some even in their hundreds, and we've had people say, I've had a long life, like I want to save the vaccine for somebody who's younger. And I love that they're thinking about others, but I actually, even those lovely people, I really need them to get the vaccine themselves, because if they're not vaccinated, they can be part of larger outbreaks in these facilities. And we've seen so many people from long-term care facilities get sick, get hospitalized, even die. Yeah. I want to protect our hospitals. Mostly I want to protect those individuals, but also just broadly, both to the residents and then to the staff. We know that there are a lot of staff working really hard. They're working third shift, second shift, first shift, sometimes at different facilities. Yeah. We know a lot of people are not in the highest paid jobs, and it's some of the most important work that we do in Chicago, honestly, taking care of our oldest residents and people who need assistance. And so there is not a group I care about more than this group in terms of really hoping that we'll see some good uptake of the vaccine.
All right. Well, that's exciting. And that's happening in 45
minutes of town hall and then a press conference again tomorrow. And we're going to keep having town halls and conversations for as long as it takes, let me tell you. I really, I want everybody's questions answered. And I know a lot of you are feeling anxious about when can I get the vaccine. We will get you vaccine absolutely as soon as we have vaccine to get you. This is just rolling it out. But there is a lot of work to think about getting us past COVID as a city. And these long-term care facilities, for example, are the absolute top priority right now. So while there is all kinds of work that is planning, I promise, 401B, for older people, for essential workers, and you're going to hear a lot more about it. It is a few weeks away before we expect being able to move into that phase, and you will get the news. And I'm really excited for all of you to be, feeling as pleased as I am to start to have access. But it's hard. It's hard to balance all of the. I mean, you should see my email. People feel very strongly, and we are doing the best we can, as we have all along, to look at the data, to look and see, where do we need to put additional resources, where do we need to work on answering questions, and I'm also really hopeful that every healthcare worker, maybe if they didn't decide to take the vaccine right at the beginning, they wanted to wait and see some of their coworkers get it, I hope will have the opportunity. It's like an airplane. As we board the airplane, right? You call people up by row. You say, who needs pre-boarding, right? Long-term cares, hospital, they were our pre-boards. And then it's like, who's in, who's the veteran and who's here. And then maybe you start at the back of the plane and then the middle of the plane. If you missed your boarding call, but you were in pre-boarding, you were in first class, you can get on the airplane anytime. You still get on. You didn't miss your chance, right?
If you're a Southwest flyer and you called late, Your Group C is still going to get on the plane.
Group C is still going to get on the plane, exactly. Everybody's going to get on the plane in Chicago, and they're going to get on the plane in 2021. Some of those, you know, if we're going to work on this analogy a little bit, but I'm kind of liking it. So you didn't miss your opportunity. If you are 1A, you know, you're a hospital-based healthcare worker, or you're a long-term care facility resident, you can get your vaccine later, but we're not going to necessarily keep coming and bringing vaccine to those settings. So taking that opportunity now is really important.
Yeah. I think it's so important for people to know. I think they can tell just by what you're saying. But your department is working so hard on this.
Yes.
Making sure that we think about you know, how to do this well. Our mayor is fighting really hard to make sure that we get vaccine and the appropriate amount of vaccine here in Chicago. So we're all working hard at that. It's very complicated, and there have been so many people who've been so negatively impacted by COVID, and so we're also really being thoughtful about who's been hardest hit, who's most at risk, and making sure that that as we do this in a way that, as you said, is going to have the most impact on the city, the entire city's immunity.
Absolutely. Getting us past COVID is the goal here. And so we're balancing a lot, but I really appreciated the many partners who have been part of this. And, you know, thanks for mentioning my team. You guys, my team is working we've been working all through COVID, but we have added this vaccine work to the ongoing testing and contact tracing and education and outreach. And I've got people at the office by 6 a.m. and, you know, still there when I'm talking to them late at night, and just working 7 days a week. And I really want to thank everybody at the Chicago Department of Public Health who is stepping up and doing all of the pieces that this is taking, as well as our many partners, our hospitals, our pharmacies, our outpatient providers, who are going to be our partners as we vaccinate Chicago, and all of the outreach workers who are out, you know, knocking on doors as part of Protect Chicago, bringing information that will shortly be transitioning into information about vaccine, how to get your vaccine, where can we get you an appointment. There's a lot of planning about how to do this out, but yeah, you know, every person I'm talking to at this point is just working overtime to try to, you know, get the data piece fixed or sort out how to show this better, or how can we get more messaging, and how can we set up town halls, and how can we make sure that vaccine is not going to waste. So yeah, huge thanks to my team as well. Thanks.
Yeah. All right. So I guess we'll close it out now.
We'll close it out now. I know that was a long soliloquy.
That's okay. That's okay. A lot of gratitude that needs to be shared, and a lot of people that need to be acknowledged. I'll throw a little plug in for the Racial Equity Rapid Response team too. That comprises many of those partners, but just want to be...
And folks at the mayor's office, I mean, this is like an all hands on deck, let me tell you. This is like how we are getting past this, and there is just... I mean, I don't know what's more important than sort of the recovery of our city, right?
Yes.
And so it's a lot, but there's been a lot of really good positive energy, and we are just pushing that out as quickly as we possibly can. So.
Yes. Yep. COVID has helped us accelerate our ability to collaborate.
Yep.
And coordinate. So, all right, we wish everybody a great weekend. You'll be back on Tuesday.
I'll be back on Tuesday, and in the meantime, we're filming a lot of these one-off questions. Go to the website, chicago.gov/COVIDVAX, VAX, or you can get there off the main page. And we're filming stuff, we're putting in questions. When you ask questions and we don't get to them, we're often turning them into frequently asked questions on the website if we're hearing them a lot. So please explore. As you educate yourself, you help us educate Chicago. So.
Yep. All right, so let's all do our part to protect Chicago.
Absolutely. Protect Chicago, keep wearing that mask, and keep being excited about vaccine like we are. Have a good day.